Doctor, I know you also work with a lot of patients who suffer from sleep apnea and certainly TMJ problems. So what are you doing to help those patients?
Well, let me first address sleep apnea, because sleep apnea is becoming more of the public's becoming aware of it. And almost all the public has some experience with snoring. And so I'll start off with that. In snoring, what we're actually doing, and I'm a snorer, my wife tells me, and in my case, in looking into the research and finding out what's really going on, is our airways closing while we're sleeping. And it's because of sleep positions and different things like that. But if our airway closes, we start fighting for air. And you need air. How long can you hold your breath?
Right.
And that's what all the sleep studies are showing when they videotape people sleeping and all that. If their airways close, they're fighting for air, really, and it's a strong urge to breathe, or else you're going to die. So we're really fighting for air, and that's the first stage of sleep apnea. You're snoring, and but your airway just closes for a few seconds, and so. And you got that snoring going on, but your airway's opening up, and so you're not developing hypoxia and lack of oxygen. But the people who go into sleep apnea, they are stopping breathing anywhere from 30 seconds to a minute and a half, and you can't hold your breath much longer, especially in your sleep. So in sleep apnea, it becomes very, very much of a medical problem then, and so. There's a revolutionary new dental device that helps when you just snap an appliance on the upper and lower, on your upper teeth and lower teeth. It just helps keep it, the little device keeps the jaw forward, and it keeps the airway open. And so you're not snoring, you're getting all the oxygen you need, and then the result is in the morning you wake up much more refreshed, and you're just having a much better day because you're not tired all day long.
Right. And what about your TMJ patients?
Well, it's amazing that most of the time with TMJ, it's all related to the way the teeth come together, the bite, when you're chewing, and if the bite's off, then eventually you get this syndrome or this name called TMJ. You get TMJ problems, and it's just standing for temporomandibular joint, and it's the joint that's affected by your teeth. And so if the bite's not even, you have to look into what's appropriate for each patient. Each patient will have a combination of three things, and it's either that you want to reposition the teeth, you want to reshape the teeth, or you want to restore the teeth back to because they wore down or something. That's what threw off the bite. So it's one of those three things or a combination of those three when it comes to TMJ problems. And when I said repositioning the teeth, a lot of times it's simply repositioning the teeth, the lower jaw comes forward, which the TAP appliance does, opens the airway. So a lot of times when we're treating and helping the patients eliminate their snoring problem or their sleep apnea problem, it's helping their TMJ at the same time.